In this video, I'm going to give you the most common cause of musculoskeletal pain and joint dysfunction that is commonly missed. I see it all too often. And we're going to get started right now. Hello everyone, I'm Dr. Glenn Harrison and welcome to this week's segment of Why. This is where we take just a few minutes to answer some of the most common health-related questions and problems that I see in my office every day. So the question today is, Dr. Harrison, I've been dealing with this chronic achy pain in my joints and my muscles for forever. It almost seems like forever. What can I do? Well, before I get into this missed cause of chronic and musculoskeletal and joint pain and dysfunction, I want to give the two most common causes first, and then you can rule those out on your own. So the first cause is, sprains and strains. Sometimes these happen that we're not even aware of. It can be postural, it can be repetitive behavior. Sprains and strains are very, very common, and musculoskeletal imbalances from one side of the body to the other. So we see this, so that's a common one, probably aware of. The other most common one is where we get into traumas and accidents and car accidents. These can definitely lead to the sprains and strains, but they're more obvious. They happen, there's an acute injury, and then we have to recover from that. So both of those causes to musculoskeletal disorders are, they can be managed. I would say they can definitely be managed with the body work, the acupuncture, the massage therapy, all of those different forms of body work, and there's so many different techniques out there. And then chiropractic. Chiropractic is a very powerful thing. I think I might be a little bit biased. My background's in chiropractic, but it might be the fastest way to get out of that acute pain. So in my perception and what I've seen, chiropractic is one of the fastest ways to get out of that acute condition and get you moving again. But there's a third problem here, and this is the one that I see in my office all the time, and that's that chronic kind of slow lingering dysfunction that's been going on for a long time. And it can be in our joints, it can be in our muscles, and this is due to inflammation. And I've talked about inflammation before many a times on this channel, but inflammation is just an exaggerated response, an exaggerated immune response that starts affecting our joints and our muscles. So this is one thing that is commonly overlooked in the musculoskeletal model, because inflammation is due to an immune response, and the immune response is due to everything that's irritating the body, physical, chemical, and emotional irritation. So that is the piece. How do you know if your symptoms are due to chronic inflammation and not just... It's if you keep going to bodywork providers, again, the chiros, the massage therapist, the acupuncture, and all of the others, and PT, and you can never really get past it. It gives you some temporary symptom relief. So that's one thing. Body work only gives you temporary relief. That's one reason to know that you have to look at inflammation. The second thing is if you've been diagnosed with an arthritis, all sorts of arthritic processes. These are very common. A lot of people have arthritis, but is it the contributor to your symptoms? A lot of times it is, and all forms of arthritis has at least some component of inflammation. So just because you have arthritis doesn't mean there's nothing you can do with it. I have seen reported 70 to 90% improvement in arthritic disorders, arthritic pain, due to addressing the inflammation model, addressing the inflammation in the body. So that's a second thing, if you've been diagnosed with arthritis. A third thing is if you've been suffering with this musculoskeletal and joint dysfunction for anywhere from 3 to 6 months minimum, but it could have been going on for 30, 40 years, your entire life. That is going to be chronic, and there's going to be an inflammatory component to that. And any post-surgical procedures that you don't quite recover from, or car accidents in the past that you don't necessarily recover from completely, there can be some permanent damage, but the inflammatory response, the immune response, is trying to heal that, and it can be exaggerated, amplifying your symptoms. So that is kind of musculoskeletal joint pain in a whole. And our clinic, we practice integrative functional diagnostic medicine, so we're always hunting down inflammation, and we see drastic changes with the inflammatory causes of musculoskeletal pain. And just recently we started to introduce musculoskeletal work. We're doing chiropractic again, so now you can do both. With inflammation, chiropractic is just part of the story. That'll get you moving. It works fast. But the functional medicine model, looking for inflammation and removing it with natural strategies, that is really where people can take off and be on their own. So hopefully this was helpful. Reach out if you have any questions. There's a lot on the site and a lot in the other videos. And I look forward to talking next time, where we're going to answer the why to another health-related question. Have a great day.